If you're anything like me, like learning anatomy through sports injuries, this is episode 24. Tom Segura, December 1st, 2020. Now you're saying Fielding Tom isn't an athlete, and you'd be exactly right. So this is Tom, and he's trying to dunk in a dunk contest, and obviously he's unable to do that in this situation. So here he plants his foot, and in this moment, his patella tendon explodes. Now his hands are up, praising God, and he's going to fall back. Now he puts his arm almost behind his back, lands on it. You can actually see a deformation here in his humerus, and he rolls over onto it. And he's in bad shape, and that's not good if you are Tom. So this is just another angle at full speed. And this arm is excessively internally rotated. I didn't leave it in, but his buddy came over and moved it from the back of his back to the front. And we'll talk about why that's bad here in just a minute. So what happened for Tom? Well, he had a patella tendon rupture, basically. And now your patella tendon connects your patella, your kneecap, to your tibia. And it's basically an extension of your quad and allows for knee extension. And so when that explodes and he's trying to push off, he can't push off anymore. And that's kind of why he fell backwards like that. So that's why he fell. And then when he fell, he landed on his arm or his humerus, as we see. This is this big bone that's the first bone coming out of your arm from your shoulder. And he had a fracture. Now, the reason we don't want to move it when it's fractured like that and kind of in a weird spot is because you have a nerve that wraps around the back of your arm and all the way through your elbow to the back of your hand, okay? So that's the radial nerve. And when you move it like that, if it's fractured, if the bone is fractured, there's a chance that you could deal with some permanent damage. And it actually ended up happening here to Tom. So what happened? What did they do? Well, he was carted off from this event and taken to a hospital. He actually decided to not have surgery at this hospital because he thought it was such a bad hospital he wanted to switch. So he did that. He had surgery where they did a reduction. They did a repair with hardware on his humerus, and they had to repair his patella tendon as well. Physical therapy to address shoulder and arm strength, quad and knee extension strength, gait training, mobility tasks. They also had to address wrist drop because the radial nerve is responsible for the extensors of your wrist. So when he had damage to that, he was just like this, and he couldn't move his wrist up or extend. Okay, so they had to address that. And normally, a nerve injury like that could take anywhere from like 10 to 18 months. It really depends on who you are. And I think it took a little bit longer for Tom here. But he did return to sports or stage 6 months after out of a brace as a result of his physical therapy. But it was a little bit of a longer recovery because he contracted COVID at this time. But he's back and he's still doing his thing. So that's Tom Segura.